Receiving a rosacea diagnosis can almost feel like a relief because now you have a name for what you've been experiencing. But a diagnosis is a description. It's a language to describe what your skin is doing. And what a diagnosis is not doing is explaining why it got there. And in my experience, the most useful conversation starts when we begin to ask why. So that's what we're going to do in today's episode. You are listening to Skin, Earth, Vitality, the podcast where ancient wisdom meets modern vitality. If you are seeking to reconnect with your innate vibrancy, you're in the right place. I'm Emily Davis, a seasoned holistic esthetician and herbalist. Join me as we unlock the secrets of ancient skincare practices, explore the beauty of seasonal and nature-based living, herbalism, and true holistic well-being for you and the broader ecosystem. This podcast is brought to you by Stratum Aesthetics. Head to stratumaesthetics.com to find curated skincare, body care, and other wellness products hand-selected by me. Now enjoy the show. Please remember that the information I share in this podcast is based on my personal and professional experience and is intended for educational and informational purposes only. It is not individualized skincare advice, nor is it medical advice. I encourage you to take charge of your own health decisions and listen to your body, seeking out the resources and professionals that best support your wellness journey. Welcome back in. If you haven't listened to last week's episode called Why Is My Skin So Red? Go check that out. It's going to give you the foundation of what we're going to talk about today, because rosacea is what happens when the patterns that I talked about in last week's episode, like diffuse redness, become more chronic, more structural. This is an episode that I've been working on for quite a while. I've had 2 clients who inspired me to create this episode, asking me to talk more about rosacea on the podcast. And I sat with it for a couple of months because I learned about rosacea in school, but everything I'm going to share today is what I wish I would have learned about it in school. It felt very vague to me for many years. And so I really wanted to have some time to do some research, mull over the info, sit with it, let it sink in. So I'm really excited to finally be talking about it because this is kind of a long process in the making and now it's finally here. If you like the way that I look at skin, you'll love my weekly newsletter. I share quick, holistic tips, tricks, recipes, things I'm thinking about at the time every Monday in your inbox. So you can sign up through the link in the show notes. Okay, what actually is rosacea? Like I said, it felt vague to me for a long time. Like, is it just red skin? What's going on? And I think the reason that I felt like it was vague is because there's not a definitive biomarker for diagnosis. There's no blood test, there's not a biopsy, but not everything that's red is rosacea. So working with a dermatologist, they will be able to rule out other things that it might be. But it is subjective. And of course, I'm not a doctor. I have no desire to try to be a doctor. So I'll leave the diagnostics to them. And working with a dermatologist can be really helpful because over time, flushing that starts to last longer and longer can lead to more permanent structural damage. So I think that it's really important not to just ignore this one. Rosacea is a chronic inflammatory skin condition that's characterized by facial redness, flushing, visible blood vessels, and sometimes pustules or skin thickening. It's episodic. This means that it flares and then it settles. It flares again and it settles. But over time, this baseline can actually get worse if the underlying patterns aren't addressed. Underlying patterns can include things like nervous system activation, immune system activation, vascular system activation. They're all being very reactive at the same time and, maybe creating kind of a domino effect with each other, like a loop with each other. And within rosacea, there's 4 subtypes. And the first one is erythematotelangiectatic. This is flushing, persistent redness, visible vessels. Subtype 2 is papulopustular. This looks like inflammatory bumps and pustules alongside redness. And this gets confused with acne constantly. I've seen this time and time again in my treatment room where somebody thinks that they have acne and then lo and behold, they actually have rosacea. And this is why I think it's really important that we never treat acne like a war that we're trying to fight. We should treat acne like a sensitive skin condition because that's what it is. We really shouldn't be going around trying to kill everything with the most aggressive acids that we can find because we may be actually working with rosacea, and regardless of what the label is, we're really just throwing gasoline on a fire when we're working with skin in that way. Subtype 3 is phymatous. This looks like, think of like a red bulbous nose. This is skin thickening that most commonly occurs on the nose. It affects men more often, and it's very structurally entrenched. We're having structural changes to the vascular tissue. And then subtype 4 is ocular. It affects the eyes. It's going to look like dry, irritated red eyes, and it's often undiagnosed because people don't connect eye symptoms to a skin condition. And the first time I learned about ocular rosacea, I was like, what? You can get rosacea in your eyes? But it makes so much sense. Our eyes are going to be connected to a lot of the same nervous tissue that the facial skin is, a lot of the same vascular tissue that the facial skin is. And we have sebaceous glands in our eyelashes. And up next, I'm going to talk about the Demodex mite, which is going to be a big contributing factor to rosacea. They feed on the sebum or oil in our oil glands, and we've got those oil glands around our eyes, and so they're going to be feeding off of that. It makes a ton of sense after you think about it. Our exact cause of rosacea is unknown, but research points to a few potential triggers, one being the overgrowth of the Demodex mite. So we all have these little mites living on our skin. I remember one teacher joking that if you ever feel alone, just imagine the hundreds of thousands of Demodex mites crawling all over you right now. They're just your little friends hanging out, and they're part of your microbiome. And there seems to be a proliferation of them in people with rosacea. And I was always taught that it was like their poop that was causing the inflammation, but they actually don't poop. It's when they die, all of the waste that they have accumulated and the bacteria living inside of them is released onto your skin, and it creates an immune response in the skin, which causes redness and inflammation. And this is why ivermectin can actually be really helpful because it kills Demodex mites, of course, reducing their population. We do want a normal population of Demodex mites. I've been talking about them like they're so disgusting or something, but I actually don't want to give that impression because everything is so intelligently created. And when we have a normal population of Demodex, they're like little housekeepers in your skin. They're feeding on excess sebum and dead skin cells and debris from your follicle. And so they're cleaning all of that up, preventing buildup of material that could be a breeding ground for really harmful bacteria. We want diversity and balance and everything. Demodex isn't the enemy, and it's not like we want to go in and kill all of the Demodex mites. And so we can use ivermectin to help kill them and hopefully maintain a normal population. But my question is, what actually causes Demodex to overgrow? they're kept in check by a healthy functioning immune system. And when that immune system is dysregulated, whether it be from systemic inflammation or chronic stress, compromised skin barrier, gut dysbiosis even, it's going to lose its ability to regulate the mite population. And the amount of Demodex mites that we have actually increases as we age. And so this is part of why rosacea might tend to show up in your 30s or your 40s where you never had a symptom for it earlier in life. And of course, gut health is also a factor here because we have what's called our gut-skin axis. And the gut and skin microbiome are in constant communication. Dysbiosis is an imbalance in the gut microbiome. Maybe we have too much of one bacteria, not enough of another, maybe just low overall diversity. And gut dysbiosis can allow for an excess amount of Demodex. And I do want to digress just for a second because I've been on the topic of gut health. I wanted to note something that I found so interesting as I was researching for this podcast. I've linked the studies that I found in the show notes showing higher rates of small intestinal bacterial overgrowth, aka SIBO, in rosacea patients compared to control groups. And when SIBO was treated in those patients, rosacea symptoms improved significantly. Isn't that wild? So if you do have rosacea, that may be something to investigate. So that's the Demodex mite. The next factor that could be playing a role in rosacea is that there's an abnormally high amount of an antimicrobial peptide. This is also a peptide that's normal. It's part of our skin's immune system. Everyone has it, but with rosacea, there's an increase of it. And it's interesting because it's not exactly part of our microbiome. It's happening in the skin cell, but increased Demodex mites increase this peptide. Another factor is TRPV1 hypersensitivity. This is a heat and danger sensor that's meant to detect a threat or call for an inflammatory response in the skin, which then dilates blood vessels. So if we have things like heat, obviously your skin's going to get red. Even a really acidic pH, so a chemical peel, your skin's going to respond by getting red because of this TRPV1 sensor. But it seems like people with rosacea, this sensor is super sensitive, and that antimicrobial peptide that I just talked about can also feed into this hypersensitivity as well. And then finally, another factor in rosacea can be autonomic nervous system dysregulation. So we have our autonomic nervous system. It's the part of our nervous system that controls all of the things that your body does without you thinking about it, your digestion, your heart pumping, breathing, and relevant for today's topic, blood vessel tone. So within our autonomic nervous system, we have our sympathetic, parasympathetic, and enteric nervous systems. And research is showing that people with rosacea have a more reactive sympathetic nervous system than people without it. Sympathetic nervous system is the side that's like fight or flight versus parasympathetic is rest and digest. So it's causing a reaction in the facial vessels to dilate in response to things like emotional stress, heat, spicy foods, all the things, more so than someone without rosacea. And I kind of want to break down the triggers for rosacea just to make this sympathetic nervous system response make more sense to you. So the first one is thermal triggers. We've got heat, hot environments, hot shower, sun exposure, exercise, sauna. Our sympathetic nervous system feels that, and it's going to respond to this temperature as a potential threat, and it's going to signal to the vessels to dilate so that they can release this heat as quickly as possible. We also have triggers like alcohol, spicy food, histamine-containing foods. these are either directly vasodilating or they're triggering the sympathetic response through nerve activation. Let's also talk about emotional and psychological triggers. Some people have a rosacea flare from things like stress or anger or embarrassment. These are all classic sympathetic activators, right? The nervous system isn't distinguishing between a physical threat and an emotional one. Maybe we have a trigger like wind, certain skincare ingredients, fragrance. Why do they put fragrance in skincare ingredients? Well, I'll tell you why. It's because their raw ingredients stank, so they have to cover it up. But this can be a trigger for rosacea. These are all activating sensory nerve endings which feed into the sympathetic response. And then also hormone fluctuations, especially estrogen shifts, which is why rosacea can worsen around perimenopause, menopause. These are going to trigger that sympathetic response. So later in the episode, I do want to talk about some tools that we can use so that we're not having this overactivation of our sympathetic nervous system. But I do want to first talk about what conventional treatment offers and then where I think we can take that further. So we have topical treatments. I spoke about ivermectin cream. This is going to kill the Demodex mites topically. And so it is going to address the mite population, but it's not going to address why they overgrew in the first place. Azelaic acid is very interesting to me because it actually reduces that peptide that I talked about. And it also has really great anti-inflammatory properties. It can also be helpful for pigment, which can be problematic, especially if you have that papulopustular rosacea that is maybe causing pigmentation after those lesions heal. It's generally pretty well tolerated. I have many clients who are on azelaic acid. There are medications that are topical vasoconstrictors that temporarily constrict vessels and reduce the redness. And then there are also topical antibiotics. These are going to reduce the bacterial and inflammatory component on the skin. And this can be really helpful for like that subtype 2, the papulopustule. So those are the topical treatments. There's also oral antibiotics like doxycycline. These are actually a sub-antimicrobial dose and used more for their anti-inflammatory effects. Of course, I'm always a little wary of doing antibiotics. They can be helpful when needed, but they are going to be disruptive to the gut microbiome. Oral ivermectin is also an option. This is a systemic Demodex treatment and often more effective than topical ivermectin for a significant overgrowth of the mite. Isotretinoin, this is used in very severe cases. This is Accutane, so it's going to super dry out the body, reduce sebum production, starving the Demodex mite. I am always really look into Accutane if you're going to do it because there are severe side effects with it. And then there's procedural treatments. So you could do laser and IPL, also known as intense pulsed light, to reduce the redness. The blood vessel is dilating and it over time can lead to what's called permanent telangiectasia. So telangiectasia is that red webbing on the face when you can see little blood vessels on your face. And when the vessels are constantly dilating and contracting, over time that smooth muscle has lost its tone and it's lost its ability to constrict again. What's happening with laser and IPL, we've got light energy heating the blood inside of the vessel to the point where it coagulates. It's kind of cooking it, and the vessel wall gets damaged in this process and totally collapses. And then your lymph system and your immune cells come in and clear up that debris over the next couple of weeks. When we're thinking about these permanent vascular changes, the consensus is that the structural damage to the vessel can only be reversed through this method. Of course, my speculation and opinion is that the body has this amazing ability to heal itself. I will never stop believing in that. I believe our body can heal anything, even things that they currently think that cannot be healed. And at the same time, as I think about this, I'm caught between two opinions. Like, one, our body is so miraculous and intelligent and it can heal, and there's never a time when something's just a lost cause. I do not believe that. And then also, it feels almost anti-human to be trying to force this idea that we must uncover healing in order to preserve the body. That feels a little bit creepy too. But if telangiectasia is causing significant distress, if it's part of a broader pattern of inflammation that's affecting quality of life, if you're seeing it progress rapidly, I do think it's worth working to restore balance. And I would say if you're wanting to potentially work on the quote unquote permanent damage to the blood vessels, it would definitely require some very deep, patient, upstream work over a long period of time. This is something that's not going to happen in weeks or months even. But I believe that the body has more capacity to restore damaged tissue than conventional medicine gives it credit for. And I'm not going to get into like specifics of what a treatment would look like here. I would imagine working with herbs like mangista, neem. These are both traditionally worked with on what's called the rakta tissue, which is your blood tissue. I'm also thinking about like vascular toning herbs. Gotu kola, horse chestnut, bilberry, pine bark, butcher's broom, that would maybe potentially work with vessel wall strength and improving elasticity, reducing permeability of those vessels, and just over time working to support the integrity of the vascular tissue. And this again is just, as an herbalist, me thinking out loud about mechanisms. If this is something that you want to try to work with, I recommend getting with a clinical herbalist, maybe an Ayurvedic doctor, a Chinese medicine doctor, and see what they have to say about it. As always, I'm a big believer that you're never going to be able to out-herb a lifestyle. Food and lifestyle habits are always foundational before herbs should ever enter the picture. But now that we understand what's actually happening in rosacea, we've talked about the mechanisms, what conventional treatment is doing and isn't doing, I want to give a different pair of glasses for looking at your own rosacea. This is not a protocol. It's not a one-size-fits-all answer. It's just a set of areas that I think are worth investigating that your dermatologist probably hasn't pointed you toward yet. And in my almost 20 years of working with skin, I think these are the most powerful places to look. So let's first talk about skincare. What have you been putting on your skin and for how long? If you've had years of harsh cleansers, actives, acids on your face, fragrance in your skincare, these have most definitely contributed to a barrier that's just constantly getting broken down a little bit every single day. And yes, it rebuilds, but if you're doing that every single day, we're going to have nerve endings become more and more sensitized. Our skin's going to be more and more reactive. And I love Blissoma's products for rosacea-prone skin. I think their pure moisturizer and their SPF are top-notch. If you're looking for just a very calm, fragrance-free, beautiful moisturizer that is like my answer to those popular quote-unquote dermatologist-recommended moisturizers, Blissoma's Pure is beautiful. I carry all the products I'm going to talk about today on my website. You can go check it out. I also adore the Laurel Cooling Relief Support Cleanser. It's got all of these beautiful ingredients: chamomile, It's immediately cooling and soothing to the skin. I love their Unburdened serum, which also helps with lymphatic movement. I love, love, love their Recovery Balm. It's a balm moisturizer. And to pair with the Unburdened serum and or the Recovery Balm, I do want to give a special mention to the Laurel Hydrating Elixir number 2. This is a gorgeous blend of hydrosols. We have chamomile and calendula, and it also has echinacea in it, which I think is such an underrated skin ingredient. You know, you think of echinacea as like a cold and flu support, but I've been talking so much about the immune system in our skin and how important it is for rosacea, but also for acne. And echinacea is going to have that same immune support for the skin. It was traditionally used by several Plains tribes here in North America for topical skin infection like snake bite. I think that it's such an intelligent ingredient to incorporate into your skin regimen. Moving past topical, circadian health is such a cornerstone for your skin health. Your circadian rhythm is your body's master clock set by the light. Getting sunlight in your eyes in the morning to tell your brain it's daytime. So basically having sunlight be the first light in your eyes in the morning, not the light from your phone, getting out in the sun several times throughout the day so you're continually getting the signal of what time it is, watching the sunset, and then letting your evenings be dark when the sun is down. I have a whole episode on circadian health. I actually did 2. I don't know how that happened, but number 66 and 73 are both about how the sun and the dark affect your skin. But that's just a quick gist of circadian health. Why does it matter for rosacea specifically? We need the right amount of cortisol at the right time. When we get sunlight in our eyes in the morning, it sets that cortisol rhythm at the right time in the right amount. So it's actually going to be anti-inflammatory when we're getting the right amount of cortisol at the right time. It's chronic cortisol at the wrong times that become pro-inflammatory. Melatonin is also really important here because it's an antioxidant that helps with barrier repair. It also has anti-inflammatory activity, and screen time at nighttime suppresses melatonin production during the window when your skin needs it so much for its overnight repair. Digestion. This is probably the most important topic when we talk about rosacea. And I'm not just talking about if you're eating quote unquote clean. This has been my greatest lesson over the last couple of years, is that clean eating doesn't really mean a whole lot if you're not truly transforming and assimilating your food. And clean eating to one person could mean something completely different than clean eating to another person. It's like, are you actually eating foods that are supportive to your body? Because for years, I thought I was the cleanest eater in town, but my digestion was still so messed up to the point that I had normalized it. My invitation with this conversation is just to start getting curious about your digestion itself. How does your body actually feel after you eat? Are you pooping every single day? Are you bloated? Are you uncomfortable? Do you get brain fog after you eat? Just really starting to notice how different foods are affecting you. The second one is thinking about your food practices, because how you eat matters just as much as what you eat. So if you're eating while you're stressed out or distracted, eating in the car, I used to do this all the time, eating at your desk while scrolling your phone or while you're working. All of this means you're eating in a sympathetic state. Remember the sympathetic nervous system we talked about. You cannot digest properly in a sympathetic state. The digestive system is governed by the parasympathetic nervous system. So stress is going to take blood away from the digestive system. Also, enzymes don't secrete properly. You're creating the conditions for dysbiosis with every stressed meal, regardless of how clean your diet is. Next thing is eating irregularly, skipping meals, eating at random times, constantly grazing throughout the day. All of these are also disrupting our digestive rhythm. Also, overeating, eating past the point of comfortable satiation, or even eating before your previous meal was fully digested, overwhelms that capacity of the system. What you eat does matter. Refined sugar, industrial seed oils, processed foods, all of these are going to affect the gut microbiome and drive inflammation. And then specifically for rosacea, spicy food, fermented foods in excess, alcohol, these are all heating and potentially aggravating. And with that being said, I want to note that if you notice that you flush quickly and consistently after things like wine, especially red wine, aged cheese, again, fermented food, even leftovers, vinegar, pay attention to these things because you may want to investigate histamine sensitivity. It's a sign that your gut's not producing enough enzymes to break down histamine, or that your liver is potentially congested and not clearing it efficiently. So getting with a nutritionist or a professional who can work with you can be really helpful. And if you have histamine sensitivity, I would want to understand why my body wasn't handling histamine properly. And then alcohol. Oh, alcohol. I think it deserves its own little moment. Alcohol is a handful of issues, especially for rosacea. It's a direct histamine liberator. It's also inhibiting the enzymes that break histamine down. It's vasodilating. It's opening up those blood vessels. We know that it disrupts the gut microbiome. It increases intestinal permeability. It's taxing the liver. And then it's also messing with your sleep. So for somebody with rosacea, alcohol is probably not your friend. And now you understand all the reasons why. I talked about hormones and how estrogen fluctuation can affect rosacea. So this may be something worth bringing to somebody who can support you on your hormonal health holistically. And then the last upstream topic that I want to talk about is nervous system. We know that people with rosacea have a more reactive sympathetic nervous system than people without it. And so if you have rosacea, considering, is there a space in your day where you're not being stimulated? Do you have space when you're not consuming or producing? I would say this is so important to schedule in. For me, this looks like taking a walk without a podcast. Maybe there's some time in your drive where you're not having any input. Maybe there's silence at night when you have legs up the wall. Also thinking about resilience rather than just avoiding all stress, because that's impossible and actually wouldn't be great. I mean, can you actually imagine a life without stress or problems? Like, we don't want to numb our life out, but we do want to make sure that we have resilience. And I think the best way to do this is do uncomfortable things regularly. Let yourself sit and observe difficult emotions instead of just trying to numb it out or distract yourself. This was a huge thing that I noticed with my time off of Instagram. It really highlighted how often I was using that app to distract myself from difficult emotions or from boredom or whatever it may be. And then on the flip side, are you also getting beautiful nourishment, connection, pleasure, creativity, joy, rest, all of these things? They're not indulgences. It's all stuff that I'm actively working on, and I will say it works. It affects your skin. It is hard, but it works. Like literally your homework for your rosacea from your esthetician is to start reading silly little romance novels and get, those Emily Lex watercolor workbooks. If you haven't seen them, look her up. I'll put it in the show notes. Emily Lex watercolor books. They are so sweet, so beautiful. They're so fun. I give them for gifts all the time. And it's just such a nice way to incorporate joy and pleasure and rest into your life without thinking that rest means laying on the couch scrolling on your phone, because that's not rest, or laying on the couch watching TV. That's not rest. Like, we need true, wholesome rest and joy. Okay, I want to finish with a quick list of takeaway tools that I would consider if I was currently working with my own rosacea. So I would simplify my skincare radically. Less is more for your skin. I would have a cleanser and a moisturizer, a non-foaming cleanser, and a moisturizer that is either an oil, a balm, or so far Blosoma Pure is my favorite moisturizer for rosacea-prone skin. I would prioritize barrier support. I would work on lymphatic work. Okay, this I haven't talked about, but I did talk about it last time. The lymph brushes from Cecily Braden are one of my favorite things. The large and small bundle together is my recommendation. You can find these on my website, but start doing lymph brushing regularly and you're going to notice a huge change with redness in your face. Kanza wand is another one. This is an Ayurvedic massage tool that has Kanza, aka bronze, which is a metal that pulls heat from the skin. Also, keeping a rose hydrosol in the fridge and giving yourself a little spritz a couple times a day is quite lovely as well. Internally, I would look at alcohol first. It's a low-hanging fruit because it's hitting every mechanism simultaneously. I would get curious about my digestion. I would also look at how I'm eating, not just what I'm eating. I would really focus in on circadian rhythm, go back and listen to one of my circadian episodes, and just get morning light in your eyes in the morning and turn the screens off at night. Not all of us can turn screens off fully at night, sadly, but you can get, like, Viva Rays has great blue blocking glasses. And then finally, I would start introducing one nervous system practice. Maybe that's breath work, time in nature, practicing rest, slowing down before you eat. So I hope that these tools are helpful. I hope that this episode was helpful. If you have questions, reach out and make sure you sign up for my weekly newsletter, Moonday Notes. I will be back next week, and until then, be well. You've been listening to Skin, Earth, Vitality. If you like what you heard today, consider giving me a 5-star rating. It helps other people just like you to find the show. You can shop products and find all of my offerings on my website, stratumaesthetics.com, and follow me on my social channels at Stratum Aesthetics.